A 6-year-old boy in Subang Jaya developed sudden nausea, vomiting, and profuse watery diarrhea 36 hours after eating at a local eatery. Initial tests ruled out common bacterial causes and Clostridium difficile. With worsening symptoms, including dehydration and low blood pressure, he was hospitalized. Several children from his kindergarten also show similar symptoms, suggesting a possible viral gastroenteritis outbreak likely caused by norovirus. The case highlights the importance of outbreak investigation, supportive care, and preventive hygiene in controlling infectious diseases in children.
To better understand the cause of the child illness, we asked several important questions. First, we wanted to know if others at the eatery also got sick. This could suggest a shared source of infection. Next, we looked into any recent changes in the child diet, water or environment. New food or water sources may carry harmful pathogens. We also asked if the child had any contact with animals, especially reptiles or farm animals. This can transmit infections like salmonella if food isn't the source. Identifying the exact food and drinks the child consumed help us focus on items more likely to be contaminated. Lastly, we checked the child's vaccination history, especially for rotavirus, which is a common cause of severe diarrhea in young children. Vaccination greatly reduced both the risk and severity.
The most likely diagnosis here is acute viral gastroenteritis, specifically caused by norovirus. The justification can make through 4 areas. First, the classic symptoms, sudden nausea, vomiting, watery non-bloody diarrhea, and abdominal cramps are typical of viral causes. Second, the stool test was negative for bacterial pathogens like Salmonella, E. coli, Shigella, and C. difficile, which also makes the bacterial infection unlikely. Third, the epidemiological clue is the outbreak among kindergarten students, which strongly suggests a highly contagious virus like norovirus. Lastly, the symptoms lasting more than 48 hours align with the usual 1 to 3 day course of norovirus infection. For differential diagnosis, common bacterial pathogens like Salmonella, E. coli, and Shigella were excluded due to negative stool cultures and the absence of bloody stools or high fever. Clostridium difficile was ruled out based on a negative toxin test and no recent antibiotic use. Rotavirus was considered, but it's less likely in older children due to vaccination. Lastly, Bacillus cereus and Staphylococcus aureus were excluded because their symptoms typically resolve in under 24 hours, which doesn't match the prolonged symptoms seen here. Given these exclusions and the clinical presentation, norovirus is the leading suspected agent.
The most likely causative agent in this case is norovirus. Norovirus spread through the fecal-oral route, typically through contaminated food, water, or surface. The pathogenic mechanism of human norovirus infection are poorly understood because of the difficulty in cultivating the virus in the intestinal epithelial cell. However, several studies have confirmed that norovirus infects and replicates in immune cells, including macrophage, dendritic cell, and B cells, which lie deep beneath the enterocytes. The small intestine, especially its lining, appears to be the main site where infection takes place. Additionally, histoblood group antigens may be the point of initial viral attachment on the surface of mucosal epithelial cell before the virus begins the infection process. The exact cause of diarrhea in human norovirus infection is still unclear. Despite the gut lining usually staying intact, changes like broadening and blunting of the small intestine villi have been observed. Furthermore, evidence suggests that norovirus-induced diarrhea is likely due to alteration of secretory or absorptive process of the gut, rather than direct structural damage. During norovirus infection, the malabsorption of D-xylose, fat, and lactose could be related to shortened microvilli and decreased brush border enzyme activity. Nausea and vomiting may result from delayed stomach emptying, caused by change in the gastromotor function. Additionally, the buildup of cytotoxic T cells in the gut lining may result in enterocyte apoptosis, further affecting gut function.
While norovirus is often diagnosed based on clinical symptoms and outbreak patterns, RT-qPCR or real-time reverse transcription PCR is the gold standard for lab confirmation. It's highly sensitive and specific for detecting norovirus RNA in stool samples and can even estimate viral load. On the other hand, Enzyme immunoassays, or EIAs, are available for rapid antigen detection. Although they provide quicker results, their sensitivity is relatively low, around 50 to 75%, making them unsuitable for diagnosing individual or sporadic cases. However, during outbreaks, RT-qPCR is the preferred method. EIAs should not replace RT-qPCR in outbreak investigations due to the limited accuracy.
Other patients with similar conditions have experienced a variety of symptoms include fever,
loss of appetite,
irritability or lethargy, muscle aches or headaches, dehydration, abdominal bloating, chills or malaise. These symptoms are not specific to one illness, but they help in recognizing and managing the condition better.
There is currently no cure for norovirus, but there are treatments that can help relieve symptoms. Such as rehydration. It's very important for patients to drink plenty of water. Oral rehydration solution is a drink that contains electrolytes, which can help your intestine absorb fluids and electrolytes more efficiently than plain water alone, or intravenous fluid for more severe cases. Getting plenty of rest is important to regain strength after the stress of frequent vomiting and diarrhea. Avoid food and beverages high in sugar, caffeine, and alcohol, as they have a diuretic effect that worsens dehydration and diarrhea. Soft bland foods are recommended because they are easier to digest and reduce stomach irritation. Lastly, medications like antiemetics are used to manage severe nausea and vomiting. Antidiarrheals may be used cautiously in adults experiencing mild diarrhea, but they are usually not recommended, especially in children, because it might prolong the illness. Pain and fever reliever can be used to relieve discomfort from cramps and reduce fever.
Let's talk about what are the ways to prevent norovirus condition. First is maintain good personal hygiene. Wash your hands frequently, especially after going to the toilet and before preparing food. Dry your hand thoroughly and do not share utensils with infected persons. Second is avoid crowded spaces. If you have a compromised immunity or are not feeling well, avoid crowded spaces such as shopping mall, hospitals, HK homes, and cruise ships to minimize your risk of getting infected. Third, be mindful of contaminated surfaces. The norovirus can survive for several hours on contaminated handrails, doorknobs, and toilet surfaces. Avoid touching your hand or mouth after coming into contact with these surfaces. Next is disinfect your home. If you are caring for an infected person at home, disinfect surfaces such as those in the bathroom with a bleach solution to prevent the virus from spreading to other family members. So last is drink plenty of water. Stop mild symptoms of norovirus infection from becoming worse by staying hydrated by drinking water or oral rehydration fluid after each bout of diarrhea and vomiting. Avoid milk, fruit juices, or sugary drinks. In the conclusion, the patient's symptoms, outbreak patterns, and negative bacterial tests strongly suggest a diagnosis of norovirus infection. This virus is highly contagious and commonly spread in group settings like kindergartens. Although there is no specific cure, proper hydration and rest are effective for recovery. Preventive steps such as good hygiene and surface disinfection are important to stop further spread. Early recognition and response are essential in managing viral gastroenteritis in children. That's all for our presentation. Thank you so much.